Okay, so this one here is a bit more structured, and although I was still separating the upper body stuff in pushing and pulling, I was at least respectful enough towards the rehab exercises that I was recording them, and I'm going to be putting them here because I believe this was probably the first day when I decided that it would be a good idea to document at least the exercises that I'm doing and maybe have thoughts about why I was choosing them. Now, this being a few weeks back, I don't really know exactly what was going through my mind, and I would venture that the exercise that I was doing was basically me probing around and finding out which variation was the one that was creating discomfort in a way that was manageable. And more than that, really, I was trying to bottle a certain degree of discomfort and trying to replicate that in exactly that fashion, no more, no less. It was easy to recreate the pain if this has been a chronic and ongoing issue that I've been dealing with, but the problem was that I was never really able to manage it in a way that I could basically take small instances of that and use them as a benchmark for the work that was to come. And although I was doing some versions of a hip hinge, mainly unilateral, just to see what it was feeling like when I was placing stretch in a standing position, the main bulk of the rehab, up until now at least, has been focused on the floor doing glute bridges of some kind. Started off with bilateral and then moved rather quickly to unilateral work because I was noticing that part of the discomfort was also recreated with a certain degree of hip rotation. So if I was doing unilateral work, the fact that I had to stabilize my torso and my pelvis from the fact that one leg was up in the air was also contributing to the whole concoction of discomfort that I was experiencing. So if I was able to use that, and I would be catching two birds with the same stone instead of having to do two exercises, one bilaterally and one unilateral. So because the instance of pain wasn't really that bad, I was trying different variations with an extended leg, with a bent leg at 90 degrees, or both hips and knee. And what I was noticing quickly was that if I have my leg extended, it's kind of hard to maintain a straight line because there is a bit of a tendency of the hips to bend a little. And if I am trying to maintain that full extension, there is also a tendency of the low back to overarch to compensate. And because I didn't really want to be doing anything haphazardly just for the sake of going for a slightly more difficult progression, I stick to the bent knee variation because it was allowing the best form, and if anything, I was always able to progress it upwards and scale it with time. And at the same time, this allowed me to get pretty warm in the hip area. Those isometrics, I was speeding up, but they were taking about a minute and a half to go through those sets. So I was very warm at this point. My hamstrings were warm, so I thought that I would get something that was intense enough for me to justify having one session where I wasn't really doing only rehab stuff, but I was actually getting some work in and progressing at least with one exercise. And the exercise of choice was, of course, the Nordic curl. Firstly, and mainly because it's an exercise that I like a lot, and also because it's something that really pushes intensity to an extent that no rehab exercise would ever do, because it's not meant to do so. It's something that I want to experience on a daily basis, at least. If I'm getting a workout in, I just don't want to be going around with the excuse that I'm just rehabbing. I'm going there to get some work done. And the Nordic curls were the perfect exercise where I could be doing that. It's still an isolation movement. I won't try to mask the truth. And this is probably a bias that I have, that a movement, in order to be good, must be a compound. It must be moving different joints at the same time and must be loaded in a way that makes me think like it's a good movement to have. Sometimes I have this like skewed, weird perception of good and not so good movement to have, and compounds versus isolation has always been some kind of the line that I was drawing completely arbitrarily. And I realized that because the The paradox was that then Nordic curls were fine because they were hard enough that then I would still classify them as worth doing despite them being an isolation movement. And not that this means anything, it's just about me sort of catching myself in an old habit of categorizing things in a way that isn't really conducive to good training practices. And also I'm on a wild tangent here, so I'll probably cut it there. It was a good session though. Ciao!